At the Children's Hospital Mobile Pediatric Clinic in Washington, D.C., doctors look for the consequences of fetal alcohol syndrome.
What do I do with this?
The ear.
Very good.
This little patient checks out fine, but Dr. Gloria Wilder-Brathwaite says 20% of the children she examines at this urban clinic may suffer from fetal alcohol syndrome or other disorders that could be linked to alcohol consumption during pregnancy.
We see a lot of the learning disabilities. We see a lot of the developmental delay during the first year of life, during the toddler years. A lot of children who have difficulty with hyperactivity, impulse control, irritable babies.
And children don't grow out of this syndrome. It's permanent.
You have to read what it says first, then you put sticker.
30-year-old Carly has learned to read, but her emotional development is that of a 6-year-old, believed to have been caused by her mother's alcohol consumption during pregnancy.
Carly kind of operates on many levels like a naive child.
We will never call him fried chicken.
Doctors say fetal alcohol syndrome is often overlooked, since it's sometimes difficult to diagnose. It causes a range of developmental disabilities, including learning and behavior problems. Parents strive to have healthy babies, but health officials say expectant mothers and women who might become pregnant need more information about the consequences of consuming alcohol during a pregnancy. The Centers for Disease Control estimate that FAS occurs in about 1 in every 500 live births. They say each year between 1,200 and 8,000 babies are born with full-blown FAS. They add, many more are born with alcohol-related disorders. That makes fetal alcohol exposure the nation's #1 preventable cause of birth defects.
Well, FAS is actually more prevalent than other more commonly known health conditions, such as Down syndrome, sudden infant death syndrome, spina bifida, cystic fibrosis.
Fetal alcohol syndrome was first identified in 1973 by Dr. Ken Jones of the University of California in San Diego.
These children have problems in terms of their ability to learn. The average IQ in the fetal alcohol syndrome is about 62, but there are many children with the fetal alcohol syndrome who have IQ scores that are within the normal range, but those children do not succeed in school generally.
Dr. Jones pinpointed certain telltale signs of FAS. Individuals with the syndrome tend to have a flattened midface and a smooth upper lip, narrow eyes, and below average head circumference. They suffer from a spectrum of neurological and cognitive impairment, including developmental delays, learning disabilities, behavioral problems, and mental health issues. The diagnostic criteria for FAS include pre- and postnatal growth deficiency, characteristic facial features, a broad spectrum of brain disorders, confirmed or reported maternal alcohol use.
They're going to get a little bit harder.
In the years since full-blown FAS was identified, experts like Dr. Ed Riley believe alcohol consumption may also cause less obvious physical and developmental disabilities.
Recent data coming out from our laboratory has shown that the brains of these children with fetal alcohol syndrome are indeed affected. For example, the corpus callosum, which is the major connection between the two hemispheres of the brain, seems to be especially sensitive to prenatal alcohol exposure. In a small number of these kids, in fact, the corpus callosum is missing. It's just not there.
Chris and Alex are two bright youngsters with developmental problems that doctors believe stem from prenatal alcohol exposure. Jennifer Gowdy adopted the brothers from Russia when they were toddlers. She saw signs right away.
Well, there were the physical features, and early on in both of them, and learning disabilities and difficulties with language and processing information.
It took months to get a proper diagnosis and years to get the drug therapies and special education her sons need.
I am just totally shocked that so little is known about it, that there's so little help for it, that especially that educational professionals don't know more about it, since so many of the effects manifest themselves in learning disabilities.
Doctors say FAS and fetal alcohol spectrum disorders are difficult to diagnose, in part because it's hard to evaluate the central nervous system of a baby. And some of the symptoms believed linked to prenatal alcohol consumption, such as developmental delays and stunted growth, could also be caused by other risk factors during pregnancy, like drug use and smoking.
Some of these kids may not have all the facial characteristics, but they might have behavioral problems.
Doctors do not know how much alcohol it takes to cause the full-blown syndrome, characterized by the facial features, but it is more prevalent in heavy drinkers. At the Safe Harbor Substance Treatment Program in Maryland, expectant and new mothers with abuse problems meet and discuss alcoholism and pregnancy.
Well, today we're going to be talking about fetal alcohol syndrome and some of the effects that it has on the women as well as the children.
When I was pregnant with my son, they had said for relaxation, they say in a lot of the baby books that you're allowed to drink like a glass of wine or something.
Most of these women say they were never told that alcohol consumption could harm their babies. Some drank heavily throughout their pregnancies.
You can feel the effect that it has on the child. I mean, she was miserable. You could feel that. You know what I mean? I mean, every time I took a drink, she would just be in my stomach just doing flips.
Not all alcoholics will have babies with FAS, but doctors have believed for years that steady exposure to alcohol can cause the syndrome. Now, new research indicates that alcoholic binges, where a mother drinks heavily on occasion, may also put babies at risk. The CDC considers a binge when a woman consumes 5 or more drinks on one occasion.
The vast research through the years is showing more and more that lower doses of alcohol can be of great risk, and even single binge episodes during a pregnancy can present a risk.
Some crucial neurological developments occur in brief spurts, as short as 24 hours. Doctors say the effects could be serious if an expectant mother were to drink heavily during these brief windows. A particularly vulnerable period may be very early in the pregnancy when the central nervous system is just beginning to form. Doctors now believe the distinct facial effects of full-blown FAS are caused by alcohol poisoning while the face is being formed, sometime around the 3rd week of pregnancy. The fetus develops throughout a pregnancy. Therefore, the United States Surgeon General and other experts believe, to be safe, women should not drink at all while pregnant, not even the single glass of wine that's sometimes recommended as a way to relax.
It's definitely an education problem with not only the moms themselves, knowing how much alcohol is too much, but also with providers, OBGYNs who will sometimes say, well, you're at the late end of pregnancy, maybe a glass of wine would be okay. And we are, of the bend that no alcohol, none, 0 during pregnancy.
FAS awareness groups such as NOFAS, the National Organization on Fetal Alcohol Syndrome, and political leaders have been working to increase awareness of the syndrome.
Alcohol-related birth defects and the alcohol-related neurodevelopmental disorders.
They especially want to get the message across to young people. These nursing students are being advised to counsel women who are pregnant or who suspect they may be about the potential dangers of excessive drinking.
It should really be part of a routine physical exam for a doctor to screen women for potential alcohol problems and also talk about the risk of alcohol use during pregnancy. Furthermore, doctors' offices and clinics should have pamphlets and posters that raise awareness about the risk of FAS. And junior and senior high school students should be educated about the risk of alcohol in pregnancy.
Experts like this one at the mobile clinic are well aware of FAS, but they say some professionals may need more training in the cause and effects of the syndrome. Dr. Wilder Brathwaite and others who deal with FAS say the most disturbing aspect of the syndrome, what makes it a most pressing public health threat, is that it's permanent.
If an individual with FAS does not get an early diagnosis, they're unable to get the treatment that they need. They're unable to be educated in a way that might help them overcome some of the neurobehavioral, that is, some of the learning and behavioral problems that they'll be confronted with later in life.
Experts say the stigma surrounding prenatal alcohol exposure remains for those affected and their families. Jennifer Gowdy says many health and education officials are embarrassed by her son's diagnosis.
I know some birth parents of fetal alcohol kids who just feel horribly guilty, but it wasn't until, within the last 10 years or so that anybody knew really that alcohol could affect their children.
The embarrassment surrounding fetal alcohol exposure means some children do not get the help they need, or mothers do not provide information needed for an accurate diagnosis.
That's why it's imperative that medical and allied health practitioners are talking to them about potential alcohol dependence that they may have and giving them access to treatment that they may need.
Her outfit isn't white, right?
Right.
Kathy Mitchell's daughter has been diagnosed with FAS. Because of that, she's working to educate women who may unknowingly be harming their babies.
Some of the deficits that Carly has, which is typical, by the way, with people with fetal alcohol syndrome or other alcohol-related disorders, are things like she has problems with math, which translates in the world with things like not understanding time, money. She cannot cross the street because she cannot. She can look both ways, but she can't kind of organize herself to determine how long she has to get across to the other side. They're not going to grow out of it. They're going to have that same issue when they're 40 and 50 and 60 years old. I don't think a day goes by when you're a mom that you don't think about what would her life had been like had I known, had I not drank during pregnancy. What would her experience be like? It would have been quite different.
For health professionals, the message must get out and must be clear. FAS is disabling. It's permanent. And it's completely preventable.